Diagnostic studies of endocrine system. Looking at the pituitary studies, growth hormone. Some medications are known to affect the growth hormone levels, and that includes amphetamines, estrogen, dopamine, histamines, and corticosteroids. The patient will need to fast for 10 to 12 hours before the test. They may be asked to stop all physical activities for 90 minutes before the test. Somatomedin. The somatomedin C test is primarily ordered to check for pituitary gland disorders and abnormalities in growth hormone production. Symptoms such as short stature or excessive growth, the gigantism, may warrant a somatomedin C test. Water deprivation. A water deprivation test involves not drinking any liquid for several hours to see how the body responds. During the test, the amount of urine produced will be measured. A drop in weight of more than 2 kilograms would indicate severe dehydration, and the test should be discontinued. CT. Because contrast media is iodine-based, the healthcare provider would need to know if the patient had any iodine or shellfish allergies before a CT scan. Also, because contrast media may cause acute kidney injury in patients with poor renal function, the healthcare provider would need to prescribe things like IV fluids to prevent this complication. Thyroid laboratory and radiological studies. Thyroid stimulating hormone. This is an indicator of thyroid function. A normal range for an adult is 0.5 to 5.5. To prep for the test, it can be measured any time of the day without fasting. The brain regulates the amount of thyroid hormones in the blood. When the hormone levels are low, the brain sends a message to send out thyroid-stimulating hormone. This causes the thyroid gland to send out more and more hormones. If the blood levels of thyroid hormones are high, the brain senses this and sends a message to stop producing the thyroid-stimulating hormone. This is a good test to check for hypothyroidism. The thyroid-stimulating hormone is increased with hypothyroid and decreased with hyperthyroid. Values may be lowered with the use of aspirin, corticosteroids, and heparin therapy, and the values could be higher with use of lithium, potassium, iodine, and thyroid-stimulating hormone injections. Thyroxine T4. The normal range is about 5 to 11. This test can also be measured any time of the day without fasting. Thyroxine is a hormone produced by the thyroid. It is drawn to assess thyroid function. Low T4 is seen with hypothyroidism. High T4 is seen with hyperthyroidism. The T4 blood test can also be used to monitor the effectiveness of medications used to treat thyroid disease. Estrogen, anticonvulsants, aspirin use, and anticoagulants may affect the T4 levels. They are increased with pregnancy. Triiodothyronine. This is another important thyroid hormone. T3 levels can fluctuate quite a bit, but high levels of T3 are typically due to hyperthyroidism, while low levels are caused by hypothyroidism. A high radioactive iodine uptake is through thyroid scanning. Radioactive iodine is the most common treatment for Graves' disease, although surgery may be used. If the patient has radioactive iodine, they are isolated for 3 days, but if they have a tracer, it's okay to be around family. There is a high incidence of post-radiation hypothyroidism after a radioactive iodine uptake. The patient should be monitored for symptoms of hypothyroidism. The radioactive iodine has a delayed response with the maximum effect not seen for 2 to 3 months, and the patient will continue to take antithyroid medications during this time. The therapeutic dose of radioactive iodine is low enough that no radiation safety precautions are needed. The thyroid scan is often used along with the radioactive iodine uptake, and a thyroid scan can reveal specific regions in the thyroid that are using either too much or too little radioactive iodine. This scan can help decide whether a thyroid biopsy is necessary to confirm a diagnosis. Ultrasound images of the thyroid can show underlying structural causes of thyroid disease, such as a tumor or a cyst. Parathyroid studies. A parathyroid hormone blood test measures the level of parathyroid hormone in the blood. This test is used to help identify hyperparathyroidism, to find the cause of abnormal calcium levels, or to check the status of chronic kidney disease. Parathyroid hormone controls calcium and phosphorus levels in the blood, calcium total and ionized. If the calcium is abnormal, measuring calcium and parathyroid hormone together can help determine whether the parathyroid glands are functioning normally. Measuring urine calcium can help determine whether the kidneys are excreting the proper amount of calcium, and testing for vitamin D, phosphorus, and or magnesium can help determine whether other deficiencies or excess exist. Part of the total calcium is bound to albumin, so hypoalbuminemia can lead to misinterpretation of calcium levels. Tetany is often associated with hypocalcemia. Phosphate. Both parathyroid hormone and calcitrol drive calcium out of the bone and into the bloodstream, which raises calcium blood levels. In the kidneys, both parathyroid hormone and calcitrol reduce calcium excretions, which means they make the kidney save the calcium and not urinate it away. This further then increases the blood calcium levels. When it comes to phosphate, though, these two hormones no longer work for the same effect. Calcitrol serves to save phosphorus, and parathyroid hormone acts to dump it. Adrenal studies. Cortisol. This is a glucocorticoid hormone that helps to regulate the metabolism of carbohydrates, proteins, and fats, mediated the body's response to stress, and regulate the immune system. Oversecretion of cortisol, most often caused by a benign adrenal tumor, results in Cushing's syndrome. Undersecretion may indicate a form of adrenal insufficiency known as Addison's disease. Both blood levels and urine levels, known as free cortisol, are usually measured. Cortisol levels are usually drawn in the morning when levels are highest. 24-hour urine for free cortisol. Physical and emotional stress also can affect the results of a free cortisol test. 17 ketosteroid. The specimen must be kept on ice or refrigerated until the collection is finished. Voided or catheterized specimens are acceptable for the test. The initial voided specimen is discarded, and there is no fluid intake requirement for the 24-hour collection. Elevated levels could be a tumor, Cushing's, ovarian, and testicular cancer. Decreased levels could be Addison's disease, kidney damage, or hypopituitarism. Aldosterone. It controls the salt, potassium, and water balance in the body and helps to regulate blood pressure. Overproduction, hyperaldosteronism, or underproduction, hypoaldosteronism, of this hormone may be caused by tumors or other abnormalities within the adrenal glands, or may result from problems outside the adrenals. Both blood levels and urinary excretion of aldosterone may be measured. Acth stimulation. Blood and or urine cortisol levels are measured before and after a synthetic form of ACTH is given by injection. In the so-called short or rapid ACTH test, cortisol measurement in the blood is repeated 30 to 60 minutes after an intravenous ACTH injection. The normal response after an injection of ACTH is a rise in blood and urine cortisol levels. Patients with either form of adrenal insufficiency respond poorly or do not respond at all. ACTH suppression. The overnight dexamethasone suppression test checks to see how taking a corticosteroid medicine called dexamethasone changes the levels of the hormone cortisol in the blood. This test checks for a condition in which large amounts of cortisol are produced by the adrenal glands, like Cushing's syndrome. Insulin-Induced hypoglycemia test. This test determines how the hypothalamus and pituitary gland responds to stress. The blood is drawn to measure the blood glucose and cortisol levels, followed by an injection of fast-acting insulin. Blood glucose and cortisol levels are measured again at 30, 45, and 90 minutes after the insulin injection. The normal response is for the blood glucose levels to fall and cortisol levels to rise. Metanephrine. Plasma-free metanephrine is up to 99% sensitive. This test has sensitivity to measurement of circulating epinephrine and norepinephrine because plasma metanephrines are elevated in pheochromocytoma.